Testing, testing. Oh, good. Hi, Mildred. Hi. How are you? Mildred, can you hear us okay? Sure. Thanks, Mildred. Oh, good. He belongs to her. And then Janine, I don't know if you got Helene Hervey. You do? Okay. Hopefully it'll close. Hopefully. Oh, just clear, because it's a motion. Hopefully it'll work. There we go. Hey, glad you made it. All right, good to see you. All right. How are you? Hey. How are you doing?
Listen, honey.
You hanging in there?
I'm getting bitchy phone calls already.
Hold on my mic. You don't want Already, huh? Straight there. I know. It's...
Tomorrow, I said I'd help you pack.
That's a shame. Yeah, that's a shame.
That's Christian.
Yeah. I know. It's so hard. I know.
Because I got the young lady from Elder Grove coming, and I have to go and get her and take her to the second floor. So
Okay.
that program and
All right. Okay. All right.
That's amazing. Did she really? And she gave a seat.
All right. How are you? Welcome back. Okay, it's about 2 minutes to. We'll be starting in just a few minutes. For those of you who are on the phone, if you could please put your phone on mute or silent, we'll be starting in 1 minute. Thank you. If you have a question or a comment at any time, if you're on the phone, please just take your phone off of mute or silent and ask your question or share your information at that point in time. Can everyone in the room hear me okay? Okay, good. Good. Yeah, that's right. Hi, Sue Perrin. I'm going to invite Etta up. By the time she gets up here, we'll be right at 1 o'clock, and she can lead us in prayer. Etta?
Let us pray. Dear Heavenly Father, we are so grateful for this season of the year, a time where we are waiting in great expectation of the coming of your Son. God, and even though we celebrate him during this season as a birth in a manger, we know that his second coming will come with all power and glory. God, continue to guide us as a community through this Advent season. Continue to allow us to be in your presence with praise and thanksgiving. Allow us to enter into your courts, God, and bring forth our petitions before you as you continue to not only nurture us and lead us, but you also continue to pour out your love upon us. Continue to guide us in all that we do, that we may continue the ministry that you began here at Florida Presbyterian Homes, that we may always bring you glory in all that we say, all that we think, and especially in all that we do. Let us share your joy with one another in this season and not forget those who are less fortunate than we are. In Christ's name we pray. Amen.
Amen. Thank you, Etta. For those of you who are on the phone, if you could please put your phone on mute or silent so we don't have the background noise during the program. I'm going to walk through the agenda. So I know we sent out the agenda, but you probably didn't bring it with. So I'll just walk through the agenda so everybody knows the topics for today. The first thing we're going to do after prayer is introduce Tasha, and eventually Katie, hopefully, will introduce both of them. And then I give my report. In my report, I'm going to cover our occupancy update, where we're at with the strategic plan, where we're at with the resident handbook update, provide an update on the memorial garden, update you all on where we're at with the search for our social services director, and then go through COVID protocols for residential living and independent living. Some of the things we've been working on and addressing we'll cover today. There's also two other topics I want to add today. There was a situation last night that I want to make residents aware of and address that issue with the residents. And then I've had two residents that asked me about legislation in the state, SB 804, and I want to cover that as well. And then I'll give an update on where we're at with the search for the Port of Mcgrath administrator. And then Tasha and I will talk about assisted living. I'll give an occupancy update for assisted living. We'll talk about where we're at in terms of the roles and the functions for Katie and Tasha. And then I'll introduce Samantha. I may bring Samantha up after my report. I know she has a person coming at 10 to 2, so you need to be able to get to that volunteer because they're doing a favor for us, and we appreciate it. And then Etta will address Pastoral Care. She'll share with you what we're doing this Advent season, and then we'll take any questions and comments for anything that we didn't cover or anything that we did cover that you'd like to talk about. So with that, I'd like to ask Tasha Saka to come up. For those of you who haven't met Tasha, you may recall we had an associate executive director. Do you remember Alexis? Alexis left the organization to go to work for Orlando Health back in April. So the position of associate executive director has been open since that point in time. The position that we were working on with Alexis was a position where her responsibilities would grow and evolve. You may recall Alexis was responsible for overseeing life enrichment, our technology program, our digital media and Facebook and website. Those were the things primarily that she did along with quality improvement. So she facilitated all of our healthcare quality improvement programs. The evolution of that position was to oversee assisted living as well, to provide strategic direction to assisted living, and to grow our marketing and sales program, to be able to oversee marketing and sales. So in those changes, we made those changes, but we didn't have the person to do those things and be able to lead us forward in the organization. The other aspect of an associate executive director is this is the person when I'm not here that is the point person. So I want to introduce Tasha as our associate executive director. I sent this out to you all a couple of weeks ago in an email, and then I mentioned it again in the residential living and independent living update. I've known Tasha going on just over 2 years. We're both volunteers for what's called Age Friendly Lakeland, which is an organization that is part of the Lakeland Vision and the City of Lakeland. And it's a volunteer group that works on programs and services for older adults in the broader community. I'm going to ask if the person who's on the phone, if you could please put your phone on mute or silent by hitting *6*6, because I know you're having a personal conversation. I'm sure you don't want us to hear it. Maybe you do, I don't know. But if you could please put your phone on mute or silent, we certainly would appreciate it. Well, that's the... Okay. So with that, Tasha's been with us now for almost a month, and she's finding her way and doing a great job. We're really glad that you've started here. In fact, one of the things when Alexis was doing her exit review with me, she said, you should touch base with Tasha. Tasha's somebody who would do this job really well. And so I always listen to Alexis, and I followed up, and I'm so glad that you're here. Could you please share a little bit about yourself?
Hi, everyone.
Get your
I
mic.
know you I've gotten to meet, and it's been a pleasure. This is... Oh, okay. I figured I was loud, but...
Hi, Katie.
My mom is half my height and twice as loud. She would not need a mic, but I will use one. Is that good? You gotta hold it like you're kissing it. Right in there, huh? Is that better? All right. We'll just give a quick Lysol spray when I'm done. Hi, for those of you that I haven't met yet, it is a pleasure. This past month has been incredible. I have learned so much. My background, I'm a gerontologist. I got my master's at University of South Florida. Go Bulls. And I am a Florida native. I'm from Coral Gables, Miami. So I absolutely love Florida, and clearly I love older adults. That is something that I just felt a calling for, and I've just always, something that's very important to me in any position that I hold is to make sure that I'm helping and making the lives of people better. So that's something very important to me. It's been a pleasure. This community is unlike anything I've ever seen. We just got out of a meeting with Miss Etta and Sam, and I'm just blown away by the support that the residents provide and how much everyone cares for one another. And it's beautiful. I'm not going to cry on cue yet, but it's really, I'm so happy to be here and apply everything that I've learned in my career and bring you guys joy and a healthier, happier life. That's my goal. So I hope I can do that for you. I know I have very big shoes to fill, but you guys are amazing, and I'm really happy to be here. Let's see. Do you guys want to know anything about me? I have a cat. That is my life. And a husband. I mean, yeah, you know, he's good too. He's fine. I love both very dearly. And I unfortunately don't have any grandparents alive anymore, so I'm hoping, you know, the position is open if you guys want to apply. I would love that. Oh, I hit the microphone. Hopefully that's not loud. Yes, ma'am.
I know you have a first name.
I do.
But are you a first name person, or do you have a last name also?
So my name is Tasha Saka. I answered a few things. I'll answer to Tanya, Sasha. There's been quite a few. So if you look in my direction and, you know, I can kind of tell, I'll answer to anything. Queen is fine. No, I'm just kidding. But Tasha is wonderful. Thank you. Yes, ma'am. Saka, S-A-C-A. Yep, quick and easy. And if you say it quick enough, Sasha works too. Any other questions? So as Joe said, part of my role is going to be overseeing the assisted living and our wonderful IT program. That's been a challenge. So as you guys see issues, I know, you know, here in the chapel is something that everyone is very concerned with, so we'll be working through that. But there is a lot of opportunity here, and you guys have really done things in a beautiful way that I'd like to continue and just keep improving. Yes, ma'am.
One of the things that I see in all of the other initials that some of us don't know.
Okay.
The words, instead of whatever.
So our technology. So when it comes to computers and things like that, but yes, I will reduce my acronym usage. Absolutely. So AL refers to assisted living. That's what I was talking about there. Yeah.
You may recall Pam, in Pam's role, Pam was the person who oversaw all of the clinical aspects of assisted living, as well as all of the strategic and communication and leadership aspects. About a year ago, Maria Rivera and I had met with Pam. Pam wanted to talk to us about her role and her position. And one of the things that Pam shared was, as we were starting to look at the strategic plan and focusing on building programs to support individuals with dementia, which is an area that we've really been lacking. It's been really important, but we really haven't done a good job with it, quite frankly. And looking at the potential of a memory care facility in assisted living and/or in Port of Mcgrath, that Pam said, I really need to be two people, because I can be in a meeting and talking about assisted living and working on dementia programming, and then somebody pulls a pull cord or hits their pendant, and then I've got to leave. I've got to run to make that call Monday through Friday when I'm here. So I'm not taking Carol or one of the other nurses off the assisted living floor. So at that point in time, we were evaluating the position and looking at this with Alexis and saying what we wanted to do is have the associate executive director take all of the communication and all of the administrative tasks of assisted living and to take that responsibility on. So Tasha is the #1 person covering our assisted living, and she'll be working as well on the dementia programming and working on the potential of development of memory care within our assisted living and looking at that as well in skilled care. So a big role, big responsibility. So now, where do we go with the clinical aspects of assisted living? Because that is just as important. to make sure that on a daily basis our assisted living residents are getting the care they need, as well as if residential living and independent living residents pull the pull cord or hit their pendant and need support, that we have the right person to do that. And so with that, I would like to introduce Katie Gannon. Katie, come on up. Katie is our Assisted Living and Transitional Care Director of Nursing. She's in this role as an interim Assisted Living Transitional Care Director of Nursing. It's an interim one, so she can see if this is what she wants to do in her future, and two, so we can make sure it's the right fit for us as well. And we're looking at, in this position, her focus is resident care in assisted living, and also looking at when you have a call and you need support, Katie's the person that's taking that responsibility on and working with our nurses in assisted living. Katie Gannon. Katie Gannon. And so Katie has been with us as the nurse liaison for about a year now, as our nurse liaison in admissions for Port of Mcgrath. Her background, she's been a director of nursing in skilled care. She is an RN, she's got good experience. So we were excited when she applied for the position, because those of us who know Katie felt like this was a good fit. And she said, I want to make sure it's a good fit for everybody, so I want to give it my best and let's see what happens. But already she's had a positive impact. The other aspect of what Katie does is when we have a resident who's considering to move here and they're looking at a contract and they're meeting with me, they're also meeting with Katie. And Katie's doing the clinical evaluation to determine, is the person appropriate, and is this the appropriate level of living that we're looking at for the individual. And then in times of transition, when people need additional support, Katie is the person who you work with and facilitate that with your family, your physician, myself, Tasha, to make sure that you're getting the care and support that you need at any given point in time as the aging process occurs. So with that, I'd like Katie to say a few words and share a little bit about yourself. Thank you.
So I'm Katie Gannon. I'm not as good of a speaker as Tasha, so I'm going to do my best here. When the opportunity came up to take this position, I think what drew me into the position was Tasha, her personality and her drive to take the job, and to make it something that I think is very special. I've been a nurse for the better part of almost 30 years. Sad. I worked in New York. That's where I'm from. I worked in hospice for 11 and a half years. I worked in skilled care as an assistant director of nursing for about 3.5 years, and then moved to Florida. I've only been down here since 2019. It's been a challenge. I came down with my family, and my family went back, so they left me here. I felt some kind of way about that. I have 3 granddaughters. They are the light of my life, and I have a daughter, and I have a new son-in-law coming on. So thank you for having me. I love the work that I do, and I love to be able to help people, and this is who I am.
Any questions for Katie? Please, Helene.
Is Katie now our community nurse?
Yes.
Yes, ma'am.
Yes, ma'am. Good question. Helene was asking, is Katie now the community nurse like Pam was? Yes. Good question.
I'll
Thank
never
you,
be
Helene.
a Pam, but I'm going to do my best to live up to that.
You'll do fine. We're glad you're here, believe me. Any other
questions?
Okay. Thanks, Katie. Thank you. All right. The first thing I want to cover, and it's not on the agenda under my report, but on Waverly last night, we're assuming, in talking with the resident who lives on Waverly, she had a screen that was pushed in, and it looked like somebody tried to get into her house. She's got a Ring camera, and she's got a window camera. So Rick went there. They called the police. The police have done a dusting for fingerprints to see the screen was folded inward, so it was dusted for prints. When I called the resident about 2 hours ago, she said, I realize I've got a camera. And I said, please call the police and let them know that you have the camera, the Blink camera and the Ring camera. Have them come back and see if they have any footage on the cameras that she has. So I'm sharing that with you so you are aware. It's really important that you lock windows. You make sure windows are locked. You make sure doors are locked. She's got a beautiful dog, and she said the only time the dog barked at all was at 11:30, and she said it was just a little itty-bitty bark. It wasn't like normal bark, so she said, I'm not sure what time this occurred, but she's assuming somewhere around 11:30 at night. So there is a police report, follow up with the police. The next step, Rick and I have reached out to a gentleman that is specializing in security technology specifically, and we're making an appointment with him, and we are going to drive around that part of the campus and ask him for a recommendation on what type of technology can we put in that area to minimize any risk. We've had 2 residents that have lost planters and plants where somebody has come by. One of them's here. Okay, okay. So, and that's a white Prius that has been going around, and we've got them on film through the neighborhood association. So they hopefully have caught that person because they literally had the whole car with the plate and everything on the footage. But this woman was driving around, would see a plant and a pot that she liked, jump out of her car, grab it, and put it, in her trunk. So hopefully, with the video footage that was in the neighborhood association, they've caught her at this point in time. Bob?
Joe, Nancy and I went to the last Dixieland meeting, and the police were talking about this. Actually, the car is owned by a young gentleman, but he wasn't in the car when these things occurred. There's a lady who's going around, must be his girlfriend, and the police are still working on it.
Okay.
They think they can solve the case. But also they mentioned that those of you who have golf carts, make sure you keep locked if people are stealing golf carts too.
So Bob, I want to make sure the people on the phone heard, and if I misstate, clarify, okay, Bob? But what Bob shared was that when he and Nancy go to the neighborhood association meeting, they reported that the police know the car. It's a young man or a gentleman who owns the car. They believe it's his girlfriend. They're trying to figure it out and track it down. But the other thing the police shared with Bob was that if you own a golf cart, make sure you lock your golf cart, because there's also people stealing golf carts in the area. The other thing I would say, and the police are always putting this in their information that they send out publicly, if you have a car, don't leave valuables in the car, especially visible in the car. Make sure you lock your car. They literally look to see what's in the back seat, smash the window, take it and run. So please, if you have a car, please make sure you don't leave valuables in your car. So Donna?
Since you're talking about security, I'd like to bring up an issue.
Sure.
I sing in my church choir, and we're doing rehearsals for a big production. And so I have come into
So Donna's sharing, and you come back through Port of Mcgrath, through the Port of Mcgrath? That's, yeah, right. That's the Port of Mcgrath AL entrance, the main entrance. And it's supposed to be locked at 7. And she's come back after that and it wasn't locked. So Rick is in the back there. So I'm going to ask him, you follow up with security and check with why that is occurring. And we want, some of the situation that we've had in the past is nursing staff goes out on a break and they unlock it and go out, and then they're in their car on break and they leave it, and they're not supposed to do that. So we just need to, I have a feeling that's what's happening. So we've got to follow up with Stephanie and with Dennis and nursing to make sure that they know. We bought a system where there's a camera on the outside. So all they have to do is, if they go out, they have a camera to be buzzed back in. But they're unlocking it from the top and leaving it open. So that's what we've got to solve. Thanks, Donna. Thank you for sharing that. So with that, I'm going to move on to another topic that's come up recently, and it's the Senate Bill 804. Senate Bill 804 is Senator Albritton has proposed this legislation that is Senate Bill 804. And I've had 2 residents that have contacted me asking me, what does this mean for Florida Presbyterian homes? What does this mean for our residents? What Senator, I can't speak on his behalf, I'm going to give you what our interpretation is based on what our 2 associations are telling us. So we belong to an association called Leading Age, which is not-for-profit providers like Florida Presbyterian Homes. And then there's a for-profit group called FACA, terrible name, but that's what it's, FHCA. And so I've got the feedback from both of them. So I want to cover what this legislation means. Leading Age has not taken a position on the legislation. FACA is in support of the legislation. So 2 associations, one is supporting it, another one is not taking a position on it. So basically what the legislation is, as I understand it and have been reading and getting information from our associations, is right now, Port of Mcgrath and skilled care facilities are required to have certain staffing level, 3.6 total hours between CNAs and nurses of care per day per resident. So we meet that standard. We more than meet that standard. And if you want to check that, you can look at Nursing Home Compare. That's the CMS, Center for Medicare Medicaid Services. We have to file a report called a PBJ, payroll journal. And in that journal, it shows all the hours in our payroll so they can match it to see how many nurses, how many CNAs were paid in that time frame and match it up to the number of residents that we have to get the total amount. So when you look at that, you'll see we're 4-star rated. So that's above average in terms of staffing. What I believe Albritton's trying to do is he's looking at and saying, right now, the way that the legislation for our license for Port of Mcgrath, we have to have a certain amount of nursing hours, that 3.6, and if we can't cover that 3.6 for more than 2 days, we're supposed to report it to the state to say we don't have enough staff to cover the 3.6, and therefore we would be suspended from taking any additional residents at that point in time. That is legislation that has been around for quite a while. And the idea of that legislation is to make sure that you have adequate staff to take care of the people that are in your building. So how they check that again is through payroll, to make sure they match up what we're paying is matching up to the number of people that we're providing care for. So that's how the government tests it and checks it to make sure. So now what we're seeing is that standard, Alberton is looking at it and going, you know, because of the nurse shortage and the shortage of nurses and CNAs, this is what's going to happen to that older adult if they're in the hospital and all these providers are saying, we don't have enough staff to take care of that individual. And what does this mean for Florida Presbyterian homes? So I had a meeting with Maria Sager, and Maria was the interim administrator before Dennis DeGloria. And this was over a month ago, about a month and a half. And Maria and I sat down and we looked at how much staff we have, nurses and CNAs. We looked at how much agency staff we have and some of the problems that agency not coming in, calling off, issues with that. And we looked at it and said, we're approaching Thanksgiving, we're approaching the Christmas season, New Year's Eve. We're going to have people taking PTO. We're going to have people taking off. So our budgeted for this year was 48 occupancy. We were roughly around 55 to 56 in our occupancy and skilled care. What I asked and talked about, and Maria agreed, and Stephanie agreed, was from that point, we were going to lower our occupancy. So we wouldn't even put ourselves in a position where we were taking 55, 56, 57 people, and then potentially not have the staff to be able to serve them. So I think today we were at, what, 46 or 45, somewhere in there today. That's kind of where we need to be to make sure there's not a risk that all of a sudden we're going to be short and we're not going to meet that standard that exists today. What Alberton's looking at is, and I'm speaking like I know, but I'm assuming what he's trying to address here is, where do these people go if there's not adequate staffing? And from his perspective, he's probably saying it's better that they're getting some care in a facility than not going to a facility and being in the hospital, or not getting care and trying to get care at home. I'm not saying I agree with it. I'm not saying I disagree with it. I'm assuming that's what he's looking at. Because what he wants to do with this legislation is take away that minimum. And so basically what he's saying, you could use med techs. These are people who are trained to assist with medication management. They're not CNAs, they're not nurses, but you can use those med techs. There's also a position where it's a feeder. So they're not a CNA, they're not a nurse, but they're trained to sit with people and assist them with their meals. He's looking at therapy people and saying, if the person's getting therapy, that should count towards that 3.6 hours a day. So if they're getting therapy, they're getting med techs, they're getting, feeders. We don't have the feeders, and we don't have that program. We have PCAs who assist. They're not CNAs, they're training to become CNAs. But all of those people that are in therapy, that are providing behavioral health support, so like a nurse practitioner, excuse me, or a psychiatrist or social worker, that's what he's saying should be in that 3.6. Historically, it's only been CNAs and nurses, but now he's adding all these other positions into that 3.6. So for us, we've already taken the position of lowering the amount of people that we take in. So we're not in a position where we're providing care without the appropriate nursing in position and in place. So we have, we're kind of watching this legislation. The for-profit side is saying they're supportive. The not-for-profit is not really taking a position on it. For us, we've got to follow whatever the law states. Now, we have some flexibility. You can always do more. You can't do less. So for us, the challenge is the same challenge that everybody else has, and that's getting staffing. And that in our field is the biggest challenge in our entire field. Excuse me, let me grab some water. That's the biggest challenge we have in our entire field, is being adequately staffed with nurses and CNAs. And that's not unique to us. That's the hospitals, that's everywhere. So I think that's why he did this legislation. He's trying to minimize the risk exposure where facilities, he's also seeing that nursing home facilities, skilled care facilities all across the country and in Florida are closing. And they're closing primarily because of staffing. And they can't meet that standard to provide the staffing, so they're closing. So legislators are stuck in between a rock and a hard place. They don't know which direction to go because they feel like if we continue to push the regulation the way it is, more facilities will close. And if they close, where are these people going to go? So do I think it's great legislation? I don't think there's no answers. I mean, in some ways I understand it, but in other ways I don't feel good about it. And that's the world we're in. Questions, comments about that legislation? Excuse me. We have an advocacy committee that is made up of residents, board members, and staff. We have 3 residents, 2 board members, and 2 staff members. If anybody really has a strong interest in advocacy, we've been asking for over a year for people to join the advocacy committee. This is where you get this type of information from the state associations that we will send you, and you form your own opinion, and you determine what you want to share with your legislator. So I think it's a good tool. It's a good opportunity for people to have a voice. I'm better than my voice at this point, but it's a good opportunity for people to have a voice. So anyone who's interested in becoming, and it isn't onerous, you're going to get an email now and again from me, and you decide what you want to do. They make the technology very easy to be able to contact your legislator directly from the email and share what you want to share with your legislator. So questions, comments, thoughts? Nancy? I'm hoping we can. I'm hoping we can we don't right now. Part of it is we're getting, like I said, there's only 3 residents on it. We don't have a groundswell. So I'd like to be able to get to a point where we could meet on some of these topics. And then, because I'll give you an example, Nancy. When I was in Wisconsin, we put together, it was called Voice. It was Voice of Interested, oh my gosh, Voice of Older Adults Interested, oh my gosh, it's been so long, I can't remember. But it was called Voice, okay? And it was a group of residents, board members, and staff. And we were in Madison, Wisconsin, so we were in the state capitol. Voice of Interested Citizen Elders, that's what it was. So we would meet, and we would have topics each quarter about the legislation that was coming out. And why it was good to meet was because we started to develop position papers on behalf of the organization. And we had a gentleman who was the president of the Medical Society before he retired and moved in as a resident. And so he knew all the legislators. And he would gather us up, and we had assignments, and we would march and go into, the state Capitol building, and we had assignments, and we had to meet with our legislators and share what our position was on specific issues. So it was good. It was a good thing. I'm hoping someday we can get to that type of a place. We have enough interest where we'd be able to do that. Because to me, it was, I know our state association said it was very valuable. It made a difference. The best way is if you know your legislator, to reach directly to your legislator. The next best way is to write them, email them. Their staff reads it. They have technology that count all of the yeses and all of the nos, and then they report that to the legislator. It works. Well, I know I'm going to ask Samantha to come up. I'm going to take a break, and I'm going to ask Samantha to cover hers because it's about 22, and I want to make sure that she's able to present for you guys, and then I'll pick back up. Thanks, Sam.
Good afternoon, everyone. Okay, can you hear me well? Okay, so it is Christmas time.
This is a green light. Here, okay. Looks like it's on. Here, I'll show you. There you go. There you go.
Thank you. Good afternoon. Is that better? All right. Thank you so much. Thank you for allowing me the time. Unfortunately, I do have to leave because I have another obligation in the Port of Mcgrath. So what's going on for us this year is you already know that you're going to have the concert here in the chapel at 10 o'clock. Okay, that's going to be this Friday at 2 o'clock. Just confirming. And then also, starting for Miss Allison on December the 7th and the 9th on Tuesdays and Thursdays, starting this month, she will have her exercise classes in the LL3. That's the Lakeview side, 3rd floor for the assisted living. And then she'll do Tai Chi at 2 o'clock on Wednesdays. And that's will be in the game room. So these are new programs, and we was asked to mention these for everyone who want to participate. And then we also going to have a meet and greet for Tasha and Miss Katie for the assisted living residents to come up to the Lakeside 3rd lobby so they can also have this loving time to meet and spend time with them as well, like you all had the opportunity to do. December 17th, we will have the Cuban Burgers and Bakes food truck coming out, parking lot B, from 11:30 to 2 o'clock. And then, of course, we cannot forget our wonderful residents in the Port of Mcgrath. We're going to have December the 22nd on the Port of Mcgrath 2nd floor, a Christmas social for them. So we're going to be reaching out for volunteers to come and help us wrap gifts. We're going to be asking volunteers to come over for their wonderful time to help us do activities for them. For an example, I have Miss Helene Hervey that's coming over to the Port of Mcgrath to extend some of her wonderful time. I have Mr. Kent Bristow. He's going to be doing chat and trivia starting December 17th on Fridays in the sunroom. So little small things that you enjoy doing. If you have the time and want to come and volunteer to help us out, Port of Mcgrath, assisted living, it is greatly appreciated. And we thank you all so much, and we want you to have a Merry Christmas and a Happy New Year. Y'all have a good one.
Anything on Debbie you want to share?
Oh, I'm so sorry. That was the first thing I wanted to
That's
say.
okay.
Then my mat wouldn't work. And Debbie Masters is back. Please forgive me. She's back with us part-time. She was here full-time, but she is so graciously came back to help us out, and I'm so happy to have her. And then you know we always going to have the assistance of Miss Etta that's supporting us. We have Miss Tasha that's supporting us. We always have Mr. Joe, our right-hand man. So anything that you want to assist would be greatly appreciated. But yes, she is back with us 3 days a week. Okay, now I'm done. Merry Christmas.
Thanks. Thanks, Sam. That's all right. Thank you. Thanks. Okay, I'm going to go back to the, thanks, Sam. We'll go back to the regular agenda. Occupancy update. So we have 10 apartments, and when we say apartments, that's Nora Rife, Garden Apartments, Bauer Haynes, Four Bunker, All of the IL apartments, we have 10 available. We've been at about 9 historically over the past few months. We dropped down to 7 for a while. Now we're back up to 10. In the houses, we have 4 houses that in residential living that are available. We have, let's see, Cher has 2 that are 3 that are under renovation right now. One, new kitchen, bath, carpet, new lighting. So 3 are under renovation for sale. So they have people who are interested in them and will hopefully be under contract soon. So that's where we're at with occupancy. In the strategic plan updates, we had 3 action plans approved by the board in their last meeting. The 3 that were approved were community impact, and that's our community outreach program. The action plan was approved for the community impact. We had a task force and action plan that was developed to increase occupancy in independent living, the apartments, and then that was approved. And then we had one on philanthropy and fundraising, and that action plan was approved as well. The remaining action plans that are going forward in January to the board are Port of Mcgrath, and that's looking at how do we enhance the quality of care as well as the financial sustainability of Port of Mcgrath going forward. Life enrichment, primarily focusing on independent and residential living, but enhancing the life enrichment program. Dementia, as I mentioned earlier, there was a group that helped us put together the plan for improving how we provide support for people with dementia. Resident transitions through the continuum. That action plan will move forward to the board in January. Finance, looking at our financial sustainability. That team is going to be holding their second meeting. They're a little bit behind on this, but hopefully they'll be done in time to get it to the board in January. The dining committee, we have a dining task force. Some of that we're moving forward on. We got the SWOT analysis from the dining group, and we were already underway, and I'll tell you kind of where we're at with the dining. So obviously this past almost 2 years now has been a very unique situation. But even prior to COVID, we were hearing from residents saying we need more healthy options. And so Dean and I have reached out to 4 management companies that manage dining programs. We didn't want to bring in a whole new management company. If you bring in a management company to manage your dining program, you're paying a management fee on top of everything else that you're paying for. And Dean does a good job. Dean's a solid manager. But what we wanted to find out was, can we just take a part of your program, not your entire program, but can you provide us with healthy recipes and options? Can you provide us with a menu that matches the recipes, that a person could look at a menu and see an icon for, say, low sodium option or gluten-free option, or this can be prepared for people with diabetes. So right now, what we found out was none of the 4 said we're going to carve that out for you. They said it's all or nothing. You either take our whole program or none. But one of them did say that there's 2 companies that might be able to help you. One is called Navigator, and the other one is Nutritious Lifestyles. And Dean and I have talked to Navigator already, and they're doing a proposal for us where they would replace our entire recipe listing. Dean said that our recipes haven't been touched for almost 20 years, he's estimating. Now, Etta was sharing with me the other day that there were some updates. So we know that they're dated, and we can do better. We also know that for us, if you have a special diet, you can meet with the dietitian who's here for just a few hours a week, and we can work to provide, but it's not a proactive approach. There's very limited options. So we want to be able to have more options for people who are looking for maybe weight loss, or they're looking for gluten-free, or they're looking for a special diet. So Navigator's putting together a proposal. The one thing they weren't sure on was the icon menu that we're asking for. So they're working on that. The other one, we have a call, I believe it's next week, with Nutritious Lifestyles. And again, we've said to them, we want you to get us all new recipes and be able to show us recipes that you can take a recipe and do a little tweak to make it gluten-free, or a little tweak to make it low sodium, and then bring the icons into the menu so people can know when they sit down what are the better options from a health perspective. So we'll be meeting with them, I think it's next week. I have that meeting, or maybe even be this week. But we're meeting with them to kind of go over and get a proposal from them as well. So that's what we're already on to with the dining, because of the feedback that we've had for quite a while on trying to get us to more healthy options. So that's basically strategic plan updates. When we finalize in January, all of the members that were involved on action teams that helped us with this, we're hoping, well, even if COVID is still with us, we'll probably do some type of a gathering outside with everybody that pitched in and helped on an action team to thank them for their work and for providing this information. And we'll also ask each of the team leaders to provide the update on the action plans. And if you worked on an action plan, you'll get a copy of the final action plan that was approved by the board. So that'll hopefully be coming. We'll do that in February if it gets board approval in January. Okay. Resident handbook. We had a meeting a week and a half ago on the resident handbook with the resident handbook committee. We got about 70% of the way there. I think we still have about 30% that we need to complete. Janine has typed it up, so we'll be sending it out to that team to review and get their input and feedback. We'll meet one more time, get back together and review the final 30%. And our hope is to get it out to all the residents in mid to late January, the final document as the resident handbook. So hopefully we're close on that. How many have been out to the Memorial Garden in the past couple of weeks? I know Lynn has, yeah. The Memorial Garden, has anybody been out to the Memorial Garden? Couple, yeah, couple. So for all the people who donated time, talent, and treasure to the Memorial Garden, we raised about almost $35,000, of which $10,000 came from the Vol Shop and Bid House. So the project is complete. The plantings are in, the hardscape is in, the Memorial Garden is complete. We've had a few services out there to utilize the Memorial Garden. In January, Etta will be doing a service, a ceremony out at the garden to bless the location and the changes that were made. And all of the people who are donors will be invited to come to that event, and we'll thank them for their contributions and support towards the Memorial Garden. We're glad that that project, we finally were able to get that completed, and feedback's been good on it. So it was very grateful to those who donated. Update on our social services director, Karen Spencer, who was in social services and left the organization for another opportunity, is coming back as our social services director. For those of you who knew Karen, she's very dedicated to our residents. Her office is right on the second floor as you get off the elevator to go up to Porta Mcgrath. That's where Teresa Montoya's office was. Teresa left to go to work at the hospital. Karen is coming back to take on the role of Director of Social Services. And I believe she starts next week, I think. If I remember, it's next week or the following week. Karen Spencer will be back. COVID, RL, and IL protocols. We're up at about 90% now of staff being vaccinated. We've put the mandate on hold. We've suspended the mandate because you remember CMS said that everybody had to have, any employee had to have their first vaccine by December 6th. What happened, though, is there was a lawsuit filed, and it was enjoined nationwide, and they've suspended the CMS mandate. So we couldn't enforce the mandate when it's under suspension. So we communicated to our employees that for those of you who have not received your vaccine, you have to continue to be tested twice a week, continue to wear the appropriate mask and social distance, but we can't terminate because you're not following the policy, because the mandate at the federal level is in the courts. So we've got to wait and see how the courts respond to that lawsuit. So right now, we are continuing to educate our staff. I think last week we had 2 staff that got their vaccines, so we're up around 90, just over 90% of the staff vaccinated. So we're continuing to educate and provide them with opportunities to get their vaccine. But we can't enforce the termination because they're not following policy because of where we're at with the CMS ruling. The OSHA ruling was also suspended in the courts. So at this point, we'll continue to maintain as we are, and glad that we're at 90%. It's a lot of our staff have really stepped forward, and appreciate them for putting the resident first and putting each other first and getting the vaccine. So continuing to educate and move on that. Dining room. I want to talk about the dining room. We've been meeting with Dean, and we have an announcement on Wednesday about having guests in the dining room. And the protocols that we're looking at, guests must be screened at the Mcgrath Assisted Living main entrance if they're going to eat in the dining room. So when we put this protocol, right now it's being reviewed by our clinical team, and I've asked them to let me know by the end of the day today if they have any changes to this. Now, what I'm sharing with you is not in place now. It's under review, and I hope to be able to communicate by Wednesday. This is the plan so you can have guests in the dining room. We hope to roll it out either this Friday, or next Monday. So the protocols are those: if you have a guest that you want to invite to come to dinner or lunch or breakfast, a reservation has to be made. They have to go through the screening at Mcgrath Assisted Living entrance. They have to go through the screening process there. They have to have a vaccine card. They have to have proof of vaccination. If they have the proof of vaccination and they clear the screen, they'll be given their name tag, and then they can meet you at your apartment or meet you at your house and then go over to the dining room with you. You just have to make sure that you've made a reservation, and you have to make sure that they're vaccinated. Okay? And like all residents and staff, we're asking the guests to wear their mask inside. If you look at what's happening in the Midwest and in the Northeast, we hope that doesn't happen here, but it's in Illinois, where my daughters and grandsons live. They had the worst surge last week of all this period of COVID. They had their worst surge. I hope that's not the case and we don't have to face that, but that's why it's still important to wear a mask. And you're safe, you've got the vaccine, but you can still catch it. So it's really important to maintain that, wearing the mask. We ask them to use hand sanitizer when they go in the dining room and when they come out of the dining room. So those are the protocols. At Christmas time, we're looking at 2 seatings for Christmas: a 10:45 to 11:45 seating, and a second seating that starts at noon to 12:45. Sure, this will be printed. We'll send this out to Donna, but the first seating would be 10:45 to 11:45. The second seating would be noon to 12:45. And that's for the dining room. That's for the dining room. Okay? And that's pretty much what we've done in the past when we've had large crowds. We've done the 2 seatings. Okay, any questions or thoughts on any of this that I've talked about relative to the dining program and guests? Okay.
I remember we've had double seating before, and sometimes we had trouble with the people from the early seating sitting there talking forever and ever, and they wouldn't get up and move for the next group to come in.
Yeah.
And that's a problem, so you may want to address that.
So we've installed these electric prods under each seat, and anybody who stays, we buzz them. My liability insurance was not fond with that concept, but you're right. It's like anywhere in a restaurant. There's people who just won't leave. And if you've been on a cruise and they have different seatings, and you're like, oh my gosh, why is this? Why are we being delayed? So we'll just ask people to be thoughtful, because we need about 15 minutes to clean up. We change all the table linens. Everything gets changed out, and we spot clean and do everything in that 15-minute window. So we really need the 15 minutes. Yeah, it is. It is definitely a problem. So again, I'm waiting for clinical approval. Once we get, hopefully, clinical approval, we'll send out a notice to all the residents about these protocols that I just shared with you. We hope to start it on Friday or Monday, okay? All right. With that, I'm going to cover the Porter Mcgrath, couple more things. If you have work orders, don't pile them up. You get a work order, send it. Don't hold on and just keep running a tab. If there's something you need fixed, send it in. Do the work order. It's harder when you pile them up and you create a list, and then you send it to Rick, and he's got to fit a whole big list in. If something's wrong, send in a work order. Okay, if you're not getting a response, follow up with Lisa, and just about when will this get done? Give me a time frame, give me an estimate. Please, Nancy. There isn't. You can call Lisa and do the work order, and then Rick is email. Good. So Nancy was asking about, is there a form for the work orders? And I want everybody on the phone to hear too. What you need to do is just email or call and include Lisa Lewis, Rick, and Jono. So that way, if Lisa's not there, Rick or Jono's getting that information. If it comes in on a weekend, if it's an emergency, it's something like my bathtub's overflowing or pipe broke or something, call the 24-hour number for security. Call them. Don't put in a work order and the water's flowing. Let them know immediately. And then Rick is notified as well at that point, and we're on it. If it's something that, I want to have a fan put in, or I want to, move a piece of furniture, if it's on a weekend, they'll get back to you the following Monday, okay? The resident council asked me to cover a topic. We meet monthly with the resident council officers, and they asked me about chain of command. And for the folks that have been in the military, you know what chain of command is, very clearly what chain of command is. What we're talking about is what is the most effective way when a resident has an issue for that issue to get addressed. So let's say you're in the dining room and you ordered the chicken cordon bleu, and if you know, I don't know what that is, but if you know what chicken cordon bleu is, you ordered it and you go, boy, this isn't what I thought it was, and I really don't like it. If you send me an email saying, I really don't like chicken cordon bleu, I've got to go to Dean and go, well, did you get a lot of these? Or if you go to me directly, it takes more time to address the issue. Where if you're sitting there and you go, I don't like this chicken cordon bleu, you say to your wait staff, I can't eat this. I can't, what are my other options? And the wait staff should be able to get you another option at that moment. So the way the chain of command should work is if you're there and you have an issue, wherever you are on the campus, and you have a staff person in front of you and you're sharing that issue, the staff person, that first person, should be the first person that tries to solve your problem. That's a lot faster, because if it comes to me, I've got to go back and find out, well, how many people return chicken cordon bleu, and it takes longer. If you go to a board member, it takes them even longer because they have no idea what's happening day to day here, what chicken cordon bleu. So, it's just follow that chain. The way it should work is, let's say it's an issue like this dietary issue. We've had enough residents that have said, what are you doing about getting us healthy options, that we need to be responsive and we need to come up with a plan. If we didn't come up with a plan, let's say that the first step was go to Dean, and we had a group of residents saying, I want more healthy options to eat, and Dean said, I don't think we need it. And Dean didn't respond to you, and Dean didn't address your issue. You go, who's Dean's supervisor? Joe. So you say, I can go to Joe and say, a bunch of us are saying we want more healthy options. If you go and you look and say, there's a dining committee of the residents, if you feel like you're not getting responded to by me or by Dean, you go to the committee of the residents in the resident council and say, we've talked to Dean, we've talked to Joe, and we feel like we're not getting anywhere. The resident council then has to go, let's find out if this is a bigger issue among our resident population. Is it 2-3 people that are just don't like the options, or is this a bigger deal? So they're asking their neighbors and their friends, what do you guys think of this? We had a resident came to us with this issue. What do you guys think? If they hear that, yeah, this is a big issue, they then tell me, hey, you got to take this seriously. This is a big issue. And if I say to them, I got other things, I don't have time, the resident council president can then go to the board chair, my boss, and say, you know what? We've tried. We've gone to Dean, we've gone to Joe, we've gone to the resident council dining committee, they went to the resident council, and it's been 2 months and we're not getting anywhere. The board chair will then definitely will call me and say, hey, I need to meet with you, let's look at this, what's going on? So that's what I mean by chain of command. The best place to get things resolved is what the person right in front of you, 90% of the time they're empowered to get it solved for you. When they can't, if they can't solve it, then you go to their supervisor, their manager. If the manager doesn't attempt to solve it and doesn't bring resolution to you, go to their direct supervisor. And one of the things that in the resident council we talked about, we need to update the org chart. So we're updating the org chart. I sent out announcements about Tasha and Katie, but one of the things they recommended was get photos. So you can have a photo of the person when there's a new person or a person going into a new position. So we can post that. So you have that. So we're just started on that today, started talking about that. Janine and I literally just talked about it like a couple hours ago. So we just started on that, we'll get that in place. Let me see if I had anything else. And I think the resident council is going to talk about this as well when they meet. Let's see, on the 13th when you guys meet in here. Our Port of Mcgrath update, I sent out a notice. Siobhan Foster is our new administrator for Port of Mcgrath. We did a search. We had about 12 candidates that we looked at. We narrowed it down to 3. Those 3 candidates were interviewed by their direct reports. They were interviewed by their peers and colleagues that they'd be working with. We then narrowed it from that feedback down to 1 person who was interviewed by the floor staff. So people, nurses, aides, housekeepers from the floor in Port of Mcgrath were the final group to interview that candidate. The consensus was to offer the position to Siobhan. Siobhan will start on January 3rd. Siobhan Foster will start as the new administrator in Port of Mcgrath on January 3rd. We'll do an introduction of Siobhan in the chat in January, and I'll send out, hopefully by then I'll be able to have a photo of her and be able to send her information out. What's different about her role as administrator, one of the things when I got here was I've never seen an administrator that was involved in so many areas on the campus. Maria was amazing, Maria Rivera, but she had way too many things on her plate. She was responsible for the Love and Care Fund. So any resident that had a question about the Love and Care Fund would go to Maria. She was responsible for overseeing assisted living. Pam reported to Maria. She had way too many things that she was involved with on a daily basis to be focused and successful in addressing the needs of the people in Port of Mcgrath, which is where the priority needed to be. So in this role, Siobhan is focused solely on Port of Mcgrath, and that is her responsibility. And she will be leading Port of Mcgrath going forward as the administrator. The reports to her are the director of nursing then reports to her as the administrator. The admissions program team reports to her. Social services reports to her. Purchasing, medical records report to her. So that's where her focus will be. She's presently at a CCRC in Florida here, not so far away. She's got a great background and experience base, almost 30 years of experience in this field. She's been an administrator in many places, Illinois, Wisconsin, Florida. So we know, she's qualified, and references were very good. So really looking forward to introducing you to Siobhan. The assisted living update, and I talked a little bit about occupancy. We're at about 45 in Port of Mcgrath occupancy out of 68. That number's low again because of what I talked about earlier. We want to keep it, where we're not trying to keep filling the first floor, but then we have an issue with adequately staffing it. So the numbers are there, and we're managing that. Assisted living update, there's 7 vacancies out of the 53 assisted living units. We have 7 vacancies. Tasha, is there anything you want to add on assisted living? Okay. Any questions on Port of Mcgrath or assisted living at this point? It's about 10 after 2. I'm going to invite Etta to come up and cover pastoral care.
I know that most of you are aware that we're in the season of Advent, and you can see as you come into the chapel, the challenge has been to make it different every time you come in, give you something to anticipate, something to look forward to, changing decorations to go along with our theme. So just stay tuned as we continue to move through Advent. For some of our newer residents, all of our services that happen in the chapel will be in our in-house television on channel 733 for everything from Cressup kind of sandwiched into Highland Street. For those in residential living, we do the live stream YouTube, so you can enjoy those. And the YouTube does store those programs, so if you want to go back and look at them, if you've missed some, you can do that as well. We will be having a Christmas sing-along on the first day of winter, which is the 21st, and you're invited to come in the chapel. I do ask that those who do come to the chapel to participate in the sing-along, we will be wearing our masks. So if you feel comfortable coming and doing that, you're welcome to do that. Our seating has been prepared for 50 folks, and it's pretty much the seating that you see that's spaced out now with just an aisle down the middle for me walking back and forth. But if you want to attend and feel comfortable attending, that's going to be a very, very good celebration. Otherwise, you can watch it on one of those devices, either your television or on YouTube. We'll do a celebration for Epiphany, and so you'll hear a little bit more of that coming forth as well. So we just look forward to continuing along with our Advent theme. We've done hope, we did love, and this week we're going to talk about joy. We'll go to peace and the light, the Christ candle during that time. So if you have any suggestions or anything you want to do to help out with the spiritual life, I'm more than welcome to your input. I am going to be contacting residents along with the Life Enrichment Department to talk about volunteers for the Christmas season. So we're going to need some folks who are good at gift wrapping. I'm going to be calling on you, and if you don't make yourself known, I know who some of you are, and so I will be calling you. I'm just going to say it in advance. I will be calling you. Okay, and then I have some folks who are good at making cards. We're going to be making Christmas cards for our ALF residents as well as our Port of Mcgrath residents. And what we're trying to do is, as we move through COVID, we're still using our precautions. So rather than having folks come from the outside of campus to the inside and making us feel a little insecure with that, why not have just our community, because we know each other, we're being around each other, we're trying to keep ourselves distance, but at the same time we're following protocol. So why not we get together as a community and use the resources that we have here? We've got a lot of great resources, and I know you all have helped in the past. So there are some of you who I will call by name, and others, if you want to step up and volunteer, please do that. But there'll be a couple different occasions for you to help out, just to make sure that we have a great Christmas for the entire campus, but especially for those in Port of Mcgrath and assisted living who won't have visitors or won't have the opportunity to leave campus to go off campus to enjoy the holidays. So know if your phone rings, it'll probably be me. So I'll be calling for your help, and I know you'll be glad to help me with that. If there's some of you who've already got pockets of groups who are volunteering or pockets of groups that are doing things, would you let the Life Enrichment team know? And then that way we have opportunities. We can add you to some spontaneous events, or you can host an event or help host an event for our residents. And we're not trying to take up all your time, but if you could give us an hour, that would be great to help us out during this season. So just look forward to hearing from me. Our Samantha will be making calls together, making visitations as we go forth and make this a great holiday season. Any questions for me? I do have your phone numbers. Thank you.
Thank you, Etta. As Etta was sharing about volunteerism, it reminded me that we have a program that we started at the very beginning when COVID began, where we had a number of residents who are fairly isolated because of COVID, and they're concerned about coming out, and they're concerned about being in the public. And we've started a program back then where we had board members, other residents, and staff volunteers to call these people on a weekly basis. And we're continuing to do that. I had a daughter of one of our residents call me recently and say that she wanted her mom added to the list to receive the calls. I've contacted the 3 people who've been volunteering to make the calls once a week, and they're swamped. And so if anyone is interested in assisting in that program and calling a fellow resident, just to check in. I mean, I know the people who've done this have felt it was a very positive thing, And it literally is just, hi, my name is, and I haven't met you yet, or maybe you do know them. And it's just, how are you doing? Is there anything you need, and how are things going? And I've seen the friendships that have developed out of that program. So it's kind of a neat thing. But and you don't have to now, but if anybody's interested, let me know. Okay, we'd certainly like to add her to the list and call her. We're working on our year-end appeal. Last year, the year-end appeal raised almost $35,000 for the Memorial Garden. There's a concept and an idea that came up that will be a benefit to employees that I want to talk with Etta and with Kim and Tasha about, and see if it's something that they feel good about and something that we can move forward on. But there'll be more to come on that. I'm running out of year-end here because I can't believe we're this far into December already, so we need to get going on that. With that, any questions, comments about anything that I've talked about? Helene? Go here. Let's make sure it's on. Hold on. There you go.
There, just, no.
It's on.
Is it on?
Yeah?
Can't hear me, but that's right. I wanted to ask if you would consider opening the Vol Shop every Friday instead of just on 2 Fridays a month. We have a whole floor of healthcare residents who have really missed a chance to shop. At present, the hall is so mobbed that we can't even think of bringing them down on wheelchairs or any of that because it's just too crowded. Honey, I don't know how to do it.
You know,
Okay. Anyway, I heard last week that you couldn't even get down that hallway into the Vol Shop, so we can't do that. But it's on days that it's open to the employees and the residents. Can't be the day that we bring the health center people down, but they really do miss coming. And for all these years, actually, the Vol Shop has been theirs. It's for them. That's where the money goes. That's the whole point of the thing. And they can't go there. And they're very unhappy about that. So I would kind of hope you would think about opening it more frequently.
So you need to talk with Carol Brown, because I don't make the judgment on when and how they open. They do. And they ask me for, is it okay clinically? And I ask the clinical team, then if the clinical team says, yep. So if Carol wants to do that, yeah, just let me know.
All I was told was that you were the one that decided to only open it twice a month, so I was asking you because that's the information I got.
I talked to Carol, so I know what I have talked with Carol about. So when Carol asks me, I go back to clinical, and I say, is there a safe way for us to do this? And then I say, Carol, here's how to do it.
COVID came, and that ended all of that, but
Judy?
we should be able to.
There's a Vol Shop meeting tomorrow at 10 out of the Vol Shop members. Since I just wanted to let you know there is a meeting, and you might want to touch base with, is it Carol now, or is it?
I don't know either.
Mullen? I know she uses another name.
I don't know if it's transition.
Part of it as of the 1st of November,
Okay.
but you might want to check into that if you're interested.
Yeah, I'll check my calendar and see, but I think the first thing, start with the Vol Shop. And so, Judy, you're in that
I don't
meeting?
even know who's running it anymore.
Are you in that meeting?
I'm saying, I believe that Carol's still involved, but Chris,
Woolwine?
Yes.
Mullen is now the person in charge. She's called the meeting for tomorrow at 10 o'clock. Maybe you can just talk to her on the phone and
Okay.
give you information.
Do you want me to reach out, or do you want to reach out? Do you want me to reach out to Chris? Okay, so I'll reach out to Chris.
One of the other things is that we did have a class before COVID, and a whole bunch of us learned how to feed people in the health center, and a whole bunch of us did it. We'd go up every night and feed them supper, or some went for lunch, and then of course COVID came, and that died out. But somewhere out there, there's a whole group of us that know how to feed those people.
Okay, so thank you, Helene, because what I'll do is I'll talk with Stephanie. So when we meet on Friday, so normally we meet on Friday. This Friday we won't because we have an employee function, but we meet every Friday to talk about COVID protocols. I'll bring that to Stephanie.
Who's Stephanie?
The director of nursing. Yeah, Stephanie's the director of nursing.
Okay.
And we'll ask her if we can bring the residents who've done feeding back into Port of Mcgrath. Etta, will you help me remember that? All right, thanks. Thank you, Helene. Anyone please, Mr. Blevins. Yeah. Yeah.
Is the security van that goes around, are they stopping at certain spots to check doors on a regular basis, like each time they make a round?
Rick is nodding his head. They've got a scheduled list of the doors they have to check and when they have to check them, and they do a lock list. I don't know. I don't know the door and the time. I don't know the door and the time. But do you know which door? Which one? Yeah. What's happening is they lock it. Nurses will say, I'm going to go on break. They'll unlock it, and they'll go out on break and leave it unlocked. And so that's where we talked earlier. But they lock it, and they assume it's locked. The staff is not supposed to unlock it. So they don't go back and check. There's 185 doors. So they they check it once they lock it. They're not supposed to go back and check it again. Well, they're usually there. They're supposed to be there unless they're driving, and then they lock it and make sure it's locked when they go drive. But they can think about it this way. I can be a security guard. I'm at the station. I'm going to my car to go drive around the neighborhood, and I check to make sure it's locked. I'm driving. While I'm driving, a nurse comes down, unlocks the door. I come back, and I go, somebody unlock the door. I lock it again. So, I mean, that happens, unfortunately, probably a lot, Bruce. And that's why we've got to get the nurses to understand they can't unlock that door. Because when they unlock the door, he's making rounds, and the door is not guarded. It's not managed. And that probably happens a couple of times a night.
That may be the problem that I can draw out.
Yeah, it is. It is.
It takes about an hour for security to make a round the entire campus.
It takes an hour to make a campus round. So in that time, it's probably nurses going in and out. Nancy?
Why are the nurses going out to take a break through that door?
Because they want to go out to their car and they'll sit, call a family member, they'll have something to eat. They'll.
Another way for them to exit that we could suggest them use that?
Is there an automatic lock on one of the doors that they can exit out of and lock?
That's the closest door that leads out to the parking lot.
That's the path of least resistance once again strikes. But yeah, we'll talk to them about it again, because that's been the ongoing issue, is when they go out, they open it. Does anyone on the phone have a comment or question? Nope. Any other comments or questions? If not, thank you all for coming out. Appreciate you. Thank you for those who are on the phone.